The following segment is sponsored by Citrin Cardiology. We are once again joined by Dr. Ben Citrin, and of course we love having you in studio, Dr. Citrin. So in our last segment we talked about various testing options to evaluate a patient. So now we want to talk about types of procedures, so which may be necessary for different patients at risk. What is a cardiac catheterization, and how do you determine if one of your patients may need that?
Cardiac catheterization is a pretty common procedure performed. The heart muscle has 3 blood vessels that ride on top of it.
Okay.
And basically what we do in years past, we almost always went through the groin, but over the last 10 years or so, we've been doing a lot more through the wrist, either the right radial artery, which is below the thumb on the right, or the left radial artery. We pass a small tube up through that artery into the blood vessels to the heart muscle, and we take some pictures. We use an x-ray machine to see if there's a blockage.
Okay. Is this procedure done in an office or is it done at the hospital?
It's almost always done at the hospital, and if somebody has an abnormal stress test or their doctor feels like they need it done on an elective basis, they'll have it done in the morning and then usually go home that afternoon, or if they have a stent or something else, they may stay overnight. What most people don't know is that hospitals like Providence, where I work, that they have a team on call 24 hours a day, 7 days a week in case somebody comes in a heart attack, so they're ready for action if something happens.
Okay, let's say that the cath shows that there is a blockage. What's the next step?
Well, if there's a blockage, what we do is we use the same basic technique. We go through a little, what we call a sheath, and we take a little bit bigger equipment. We give some medications to prevent blood clotting, and then we take a small wire and pass it up through this catheter and across the blockage in the heart. We do all this under x-ray, and then we take a balloon with a stent, and I think
Yes, this is a stent here, which is kind of shocking in all honesty how big it looks, but you did say that this was going to collapse when you're using it. So how does that work?
It kind of looks like a little slinky, and it gets crimped down on the balloon, and when we put the balloon across the blockage, we actually take an old-fashioned bicycle-looking pump, and we just blow it up, and then it inflates and it deploys the stent, and then we pull everything out, and it pushes all the blockage to the side and allows the blood to pass.
Okay, awesome. Well, does a patient need to stay in the hospital, and then how long is the recovery time after something like this?
If it's a procedure we're doing that's elective and goes well, oftentimes we send people home either the next morning or even sometimes the same day. If they've had a heart attack, we'll keep them there usually overnight for a couple days just to make sure that there's no other issues.
And then of course, if a stent is placed, will it be have the vessel open indefinitely?
Usually, particularly in this day and age with all the good medications and such that we use, and if the stent's well deployed, we put it in right, usually at that spot, they rarely, if ever, will come back with a blockage. But the rest of the vessel may have some other issues that we have to address later. And
then of course, in extreme cases, when does a patient need open heart surgery?
Open heart surgery is when we see a lot of blockage in several vessels, or we see a single blockage in a very critical vessel. Oftentimes we'll recommend bypass surgery.
Awesome. Well, thank you so much for coming in. And if you need to get in touch with Dr. Ben Citrin with Citrin Cardiology, check all the information and then of course go onto their website. Thanks again, Dr. Citrin.